All right, we switched around to the back side. Now we're going to be doing, we've already done the anterior compartment. You can go ahead and lean into the chair comfortably. We've done the anterior compartment. We're still working on his shoulder. As we've worked in the past, we're gaining more ground. But again, when you start using it, it starts rebuilding, and then it's just like any muscle that you're working with. So get in here and get her opened up. I've done the anterior compartment. Now we're doing the posterior compartment. We're going to start off on a little bit lower speed, just because we are using just a standard dining room chair that you might find in most households or most places, so that you can see how to do the work, partner care. Alright, it's pretty warmed up, so we're going to cruise. Don't want to get in there and get this opened up. Now we are using just the rubber tipped head. Right now we're going to be switching here in a little bit to a more aggressive head. This head is really, really good for anybody not sure what they're doing, that's a little bit unsure of things, because it takes quite a bit of blunt force inside of there by taking the pressure off. Even if you push a little harder, it still takes the pressure off of it. Currently, Don has opted to have his arms up. I'll probably have him switch gears after a little bit, but right now that's just what feels comfortable. Going along either side on the cervical spine, it's nice to have some clothing in the way. It makes it much easier to smoothly get in there, especially when you have hair. Don't get very deep in there. You want to make sure you're a little cautious, but we are still doing a little medial lateral movement, trying to separate those fibers in the neck. We still want to do that. We still want to get those fibers separated and open. Separated and open. Separated and open. Our next video series will both have our headsets, or at least lapel clips, so that we can have good audio. There'll be more audio available at that point. Again, right here at the C7 to T1 junction, known as the non-existent C8, where all the nerves in this section come out for the posterior and the anterior complexes. I'm not saying be careful, but be understanding that they're there. You need to be paying attention to that. I'm looking right down the spine, and I'm literally pushing back into the spine, taking some strain off. Right? And back into the spine, just like that. Just like that. Taking some strain off. Now we're just going to go down the spine. Warm it up. Doing this over a shirt, even though it doesn't need to be done over that. We're doing that so that you can see that, you know, just about any condition, you can still do this work. Working the rhomboids on this side. I want to kind of just warm this side up. This is the side that we're really going to be working. This side does need work, but it doesn't need it at the same level. It needs a different type of work. You can spend an hour on each arm very easily without paying much attention. It's just when you're breaking down fibers and using different tools to get there, it takes quite a bit of extra efforts. Okay, now we're going to switch out. That was the rubber tipped one. And we're going to be switching to, let's see, Don, what do we want? We're going to go with the chisel. It's not rubber tipped at all. So it's one you do need to be a little cautious about. I'm setting it on there. Again, having done this on myself, it helps out. Yeah, it's difficult to get behind my back to do that, but I got enough flexibility now. Don, can you bring your arm behind your back? No, behind your back. Just set it back there. Use the other arm to hold it. There you go. And just keep a little bit of a strain on there. I want you to keep about 75% strain on it. Okay?
Burning.
Yeah. Said it's burning, just so you know. And I expect that it will. We're really doing some fascial tear inside of here. I'm helping to lift that shoulder blade up so I can get underneath there. Always, so I want you to keep a 75% on it, okay? Pressure on it at all times. Okay, now release. Be ready to do it again. Now go ahead and do it again. Bring that pressure up there. Release. Opening that shoulder up just a little bit more. We're going to be bringing it back medially. We're stripping those rhomboids, stripping them down.
Am I feeling that burning on the skin? Is it agitating the skin, or is it pretty much
Well, it's what the burning you should be feeling, and then I can tell here, yeah, is what we're doing is stripping those rhomboids. We're actually forcing them to open all the way up, to actually realign and open
So
all
it's
the way
not
up.
burning my skin and agitating my skin particularly?
No, it's not burning the skin itself. That's just the under layers that you're feeling. Checking that border.
That's a deep vibration.
Yeah, we're going to get in nice and deep now. Release that pressure on them.
What?
Release the pressure. Yeah. Still trying to get underneath the scapula is what I'm trying to do. Just thinking about prying that scapula up. Prying the scapula up. Yeah, more than anything, it'll come this way. You got to guide your client. You got to help them, or your friend. You got to help them know which direction to go. Release that tension.
Yeah.
Okay, go ahead and release the pressure. It's a bit of a rough tool. We're going to switch out now to what I like to call the tenderizer. Same thing. You all right, Don?
I am.
Yeah. How's that arm feeling?
Like a lot of therapy went into it.
Like she's been beat up a little bit?
Like a lot of pushing towards healing, opening up, getting deep.
So this one, even though it can tenderize, doesn't have a lot of surface area for any extra stuff, and you can feel right up there. I've noticed up there every time it came near the levator scapula, and then of course anywhere near the teres minor,
Oh.
that it just was like, wow.
Well,
Can
it's
you
just the
lean
vibe.
into just your whole chest into that, into this? Too much? Here, I'll put a pillow. Put a pillow there. That better? You want the other pillow?
Yeah, sure.
You got to get creative when you're using non-conventional thing or just random stuff. Sometimes we do this on the ground and the same thing. So this is getting deep, though, isn't it? Careful on this one. You don't leave right on top of the bone when you start pressing hard.
Nah.
A little more surface stuff for now. Speed 5. It's the vibrations that change. And you have to be cognizant of those vibrations that are in there. Oh yeah, there's your supraspinatus. Tell me about those feelings. Are they tearing, or is it just, what does it feel like for you?
It feels like the deep vibration is separating
Fibers. That's what we want.
opening up.
Yeah, and that's exactly my goal. I want to make sure I'm getting there. I'm not as sensitive when I'm not using my hands all the time, so I'm still learning that part of it. So I have to be a little more, in tune, talking with my client and say, hey, what does that feel like for you? If he's saying, yeah, we're separating fibers, that's what we want. They're going to tear a little bit in the process because the fascia's been glued up. But that's what we want, is separating fibers. And this burning back here, I totally was expecting after what you told me you felt like this morning, based on how much swimming we did. The extra strokes and stuff do definitely inflame. You can feel over the top of it the traps are guarding a little bit. We worked really, really deep. But I'm going to change to a deep pulsation. Nope, we don't want this one to bounce. We want the body to bounce, not the gun. We get that deeper vibration in there. Make sure you are in good position. You know, I like to lean on Don a little bit to make sure that he's supported too. See that deeper vibration, totally different, huh? And after sitting in there and ripping and tearing those muscles to some degree with the different tools, really opening those areas up, now to come in here and vibrate it all loose and get some circulation in there. So we can get flow. Without the proper circulation, you're going to see all sorts of diseases and degenerations of the body. You got to have circulation. You got to have blood flowing through there. The oxygenation of the cells has to be fluid. The lymphatic system has to be able to pick up and identify. The bone needs to be able to give you new red blood cells and new white blood cells. All of that stuff has to work properly, and if there's a restriction, it starts to have problems and breaks down. Eventually, things start to die. Long level of pathology of that. And we can, we can combat that by taking care of our bodies. And you spend 15 years in building it up, and not realizing how to fix it. And we want to fix it in 3 to 4 weeks. There's a lot of effort required to get there. A lot of painful effort. Because you have to become more and more aware of every single aspect of your body, every single little tiny piece of your body while you're fixing it, so that you can maintain it. Caught the bone edge right there. Not going to break the bone, don't worry about that. Bone's stronger than you think. You can bring some awareness to it. It's going to hurt if you hit it wrong, but it's not going to break it. Right there. On the right spot. See, let your client talk to you. Let your friend talk to you. If your partner work. This good partner work. For this tool right here, man. You know, and if you're unsure, call me up, have a class. I'll gladly guide you through it. You know, either we can do a Zoom class or some other type of class, or you can come out to my shop, and we're out here at the Wellness Center, and I can teach you how to use your tool properly, how to work with it. This is a big saver in my hands. It really is. It makes a huge difference on getting my client to some of the positions and speed to get them there, right? I mean, if you're thinking taking pills will take care of the pain, this will take care of it just much that same way as the time that it would take my hands to do this work. Instead of spending a couple of hours in here, I can spend a good, half that time or less. Get this thing opened up and then get in and work with my hands, do the parts that I don't do with tools. I'm trying to run away, you know that. And the point that I make when I say to people, hey, you're trying to run away, is because I want them to recognize that they need to shift and relax. Shift and relax, okay? All right. For this part of it, I just need your arm. I need you to let it fall down, please. So, get in there and just kind of do some check detail work and just see how things are. Floating around and get in behind those subscaps. Not as deep as I'd like, but we're getting through the rhomboid barrier. Front part is the worst. Teres major and minor, especially the minor, is really still inflamed. It's going to take quite a bit of time to work itself down. I wanted to do a video. This really isn't a quick video because I've done the front one almost as long, on use of the tool and just doing the upper shoulder area, the rotator cuff zone.
What makes you feel that it's inflamed in the, what you said, the teres?
Yeah, right up here. Right up here, right there, look, oh, these muscles right back here. And the reason I'm feeling it inflamed because they're really ballooned up. They're not flattened out. And if they were, then I would be able to dive right in and grab the subscaps. I'd be able to come in between. You can kind of see it's extra chunky. I should be able to actually pull the inferior border of the subscap off of there and get in there, and it's just not quite there. But I'm a lot further than I was when we started.
I see, yeah.
Because when we first started, there was no way I would have stuck my hands up underneath there. This morning for sure.
Yeah. And that's where the pain's coming from, isn't it?
Yeah, a lot of it is because it needs to be pulled up and just opened up. And you have to think, that tool right there sped up this process. I was on his back for 15 minutes in the front for about the same amount of time, and it sped up the process of me being able to get in here without my hands wearing down. Now I can spend the rest of the time, if I was going to do an hour session, doing the work.
There's the movement. Oh, yeah.
Yeah. And it's not that my work doesn't do great. It does. I know all my clients absolutely love it, and I love what I'm doing as well, but that thing's speeding up recovery.
Oh, yeah, but only with somebody with your skill to direct that tool.
Very true. You still got to know what you're doing with it. Even now, I mean, I could use it to go in behind here if I wanted to do singular stuff. So, let's see that one now. Checking our usual tests that we do, range of motion areas. Okay. Check this side. The body likes to be balanced. Let me have this arm. Oh, I'm going to get a chance to change into my shorts before we go for our walk run.
Oh, yeah.
I thought it was going to be chillier, so I was in sweats. But we're going to be swimming afterwards, and I'll be freezing if I don't have my sweats with me. So I brought them too. Yep.
Tender.
Yeah. That's in his. So this is in the thoracic duct. So this is going to be the inflammation coming off the clavicle and then off of the ribs over on this side, in between, probably a little bit right up in here. Right up in the neck, in the anterior compartment.
Why inflamed?
Well, I'm going to assume it has to do with maybe some sort of sleeping where your head's too much forward. Yeah, that's generally what it comes down to, because you can see there's a slight movement forward of everything here. That's out of line. So, of course, with the shoulders being rolled forward, that makes sense too from all that work.
Yeah, just all the healing that's taking place.
Yeah, well,
all the activity that.
Right, exactly. And think about it, every time you do shoulder stands and plow, Salambara Sargasana, it is cranking the neck forward. You got to do fish, which cranks the neck back.
Well, headstand, I do headstand for a long time.
Yeah, that's a flat, straight up and down one. So
but I think that's strengthening my shoulders and my arms.
Which causes some of this inflammation. Not in a negative fashion. This is a positive fashion. We know that we're dealing with this. We've been talking about that.
Maybe I should lay off shoulder stand, but...
No. What I mean is if you're going to do shoulder stand and plow, then you need to do fish. That's where your head's back. So you're creating this bow.
I see. Laying down flat.
That's just a reversing of that.
As a counter.
Yeah, it's always a counter, yeah. Always do that as a counter. So
because it does require effort being in headstand, you know.
Oh, yeah.
And I'm working on that effort in training.
And he's doing a really good job. Holy cow, man. He does nice headstands. So, okay, go ahead. Come on, turn around and you can say how you feel.
Oh, boy, this has been a lot of healing taking place in the last couple of weeks, and Tio's use of that machine is just an extension of his intuitive intelligence about the body and where to put the pressure, where to put those deep vibrations, and it is effective, and it is helping me, and once again, I'm grateful.
You're welcome.
Yeah.
You're welcome. And we'll keep doing now. We got this video series, how it allows a little bit of an understanding for other people who are not massage therapists and don't have the big tools and everything else to be able to do exactly what we've been doing using this tool here to help increase your hand capacity. I found it on Amazon for $150. They have them for $100 as well. You just have to buy one and figure it out. This is the Me Back one. There we go. Off of Amazon.
Let me see that just a second.
Sure.
Have you tried? You've tried this plenty of times on yourself.
I have. Well,